And of course, are there other folks in the area that treat lymphedema? You know, this is a non-commercial show, but the opportunity to really learn about this and see, even if a viewer may know whether themselves or a loved one or their parent or their children
there
may
are
have
other
lymphedema.
people, I think predominantly massage therapists, who have taken a 2-week certification course that know how to do manual lymphatic drainage, which is really wonderful.
Who are some of the folks with you there in Murrells Inlet that help? Is it principally just you?
I'm the only physical therapy practice in Murrells Inlet, and because I'm the only physical therapist, people who have insurance can avail themselves of the service. You know, whereas with massage, the situation typically it would be money directly out of pocket, and that's tough for a lot of people to handle, because with this kind of problem, you need daily or every other day intervention for a while until you get it under control. So, but this that I showed you here with the colors and stuff and the thin material is like a day sleeve or a day kind of compression garment that the patient wears during the day. This is what I found in a convention called a reed sleeve, which is a nighttime kind of a garment. It looks like something out of Darth Vader, doesn't it?
Yeah, let's see if we can hold that up there.
But the beauty of this little baby is that you can vary the compression. You see it's got a Velcro closure on each level.
Very important,
We can calibrate.
You've seen some people. You say this is only at night, though.
Well, typically at night. I'm not saying a patient wouldn't just leave the house with it on if it's comfortable for them. They might.
Sure.
But you can vary the compression at each level depending on what the configuration of the patient's arm is. You can calibrate it to their comfort. For example, we had initially calibrated, we do 30 millimeters of mercury to start on these, and one of the ladies took it home and wore it very successfully at night, and then when she woke up in the morning it had pushed the lymphedema too fast and went into her trunk. So what we did is we knocked it down to 20 millimeters of mercury. She was fine.
Really?
And it gives them those extra hours of compression so that in the morning they start further away from cellulitis, because as they go through their day and they move their arm and their bodies work, the lymphedema gathers. It's a continuum.
Well, some of the other photos here, I know we didn't bring. We principally have some examples of, so that viewers, if they see that, they know this is something that could be treated. But at the same time, this is the two arms there. One of them is particularly bad.
The right arm here is definitely got a swelling here. This is what we call a Popeye formation. Her hand and her forearm are kind of bigger than her upper arm, and you can see the difference between the two arms visually. We of course take measurements and put it in the computer at the clinic. But the last patient that had a Popeye formation that was referred to my practice was a lady who was seen in the Walmart line by another one of our patients.
Is that
who had her sleeve on, and he said, "Gee, I have my sleeve. Where's your sleeve? You must have lymphedema." And she says, "Oh, yeah, well, I didn't know." She said, "I didn't know anything could be done about it." And so my patient networked with her in essence and told her where we were, and she ended up coming and getting treatment and getting control.
Is that right?
So I'm really appreciative to you to help us get the word out, not only to the populace, but hopefully a few physicians, and drinking their coffee this morning.
Point. Absolutely.
Who've probably seen a few of these patients.
What can physicians do if they've? Well, but real quick, the left arm is kind of like a before and after.
Yes.
I mean, this is a good example of what they would want their right arm to look like the left.
Yes, and we try to get it as close to the other arm as possible, and we use the other arm as the baseline figures.
I'm sure a lot of doctors have seen examples, and they probably wonder, can I, as the doctor, do anything about it? They don't need to.
And they probably don't know that we're here. Or they typically, after, let's say, for example, let's take a cancer patient as an example going through the medical system. They go through all of the radiation and the chemotherapy that they have to go through. And then lymphedema ensues later. And they go to not their oncologist, because their oncologists have done their job. They've done a beautiful job. They've discharged the patient appropriately. Now the patient's gone back to their internal medicine guy. And he doesn't see it as often as the oncologists do. And he doesn't know what he does. He thinks, oh my God, there's got to be a blood clot. And that's, of course, the way they're trained. And they're going to rule out blood clot. So they'll probably do some diagnostics to find out if the patient is a threat from a circulatory perspective. Or they'll give them Lasix to see if they can reduce the swelling. And many of the referrals that we have for lymphedema come to us because the physician realizes after a certain bout of Lasix there's no resolve to the edema. It must be lymphatic, so they send it to us.
Wow.
So it's kind of interesting. But the two systems, the circulatory system and the lymphatic system, are very, very intimately connected. We even find at the American Society of Lymphology, the research coming from Germany and Australia indicate that embryologically the venous system and the lymphatic system are the same cells, and they differentiate out. So they come from the same root. So that really helps us with our research.
I put these up only because a lot of viewers probably have seen examples themselves, either on a loved one or otherwise, and didn't think there was anything they could do. I know I've seen aspects of that even with my own father, who wears, he may have seen a physical therapist like yourself, and of course the great thing is the opportunity to be able to turn to insurance for some help there.
Yes.
But he wears a socks.
This leg is obviously having a lymphatic overlay going into the calf, but it is clearly a combo case, and thankfully this patient has not lost the configuration of the shape of the leg. It simply has blown up in the calf a little bit. This was incredibly successfully handled with our regimen. We just do some impeccable skin care, of course, because we have to make sure the skin is always intact. And then we go into manual lymphatic drainage, compression wrappings that reduce the legs, and then we measured the patient for compression garments, and it was simply knee highs with zippers.
Yeah, I bet you a lot of folks have seen that and just didn't know there was anything they could do about it. Thought it was just old age. We've got one more good example here. We've only got about 5 minutes, Laura.
Okay, but this also shows kinesio tape, which is a tape that physical therapists typically use for orthopedic injuries. Like, you know, if you hear of an athlete getting taped and then sent back into the game? Okay, that kinesio tape, it comes from Japan, and it's used for that. But in the clinic one day, we decided to use it on a truncal problem, specifically on a mastitis that came through. And we took the tape and made it like fingers, and we put it along the channels, the lymphatic channels, and by George, it's like having a therapeutic hand on the skin as the patient moves. It just literally helps to massage, in essence, or circulate the lymphatic fluid out of the area.
That's fascinating.
So we do a lot of different little tricks to kind of make sure that not only the arm or the leg is checked, but also the trunk is checked.
And again, that's a little more like a before and after. We want that arm to become more like that.
Exactly.
That arm to become more like that. And that's
the fact that we're able to show the pictures is just so much more effective, I think.
Absolutely. Well, of course, and I know we brought this out. I don't know if we still need to pull that up, but we've got about 4 minutes, Laura.
Most people would say, oh, that's your circulatory system. That's my heart and my arteries and my veins. But no, this is your lymphatic system, and it's kind of like superimposed on top of the circulatory system. And see, you have all the nodes in the neck, in the armpits, in the groin, and it's all ultimately dumping into the intestine. And when the body has small molecules to get rid of, it puts it into the blood, and quickly the blood takes it into the kidneys, right? Kidneys filter out the blood, and then we tinkle out all the little things. Right? And that's why doctors use urinalysis to find out what the body is dumping, right? And in this case of the lymphatics, let's say you had strep throat, and the body took all these white phagocytic cells and surrounded that strep throat bacteria. Now that thing is a huge molecule. Where is it going to put it? It dumps it into the lymphatics.
You've made my job so easy this morning, Laura. I should bring in guests with props more often.
Visuals.
Just hold it up in front of my face. Let you talk.
The lymphatics, though, they're slower than circulation, and they're kind of more like sludge, and it's like that's the way, and that's why yoga, relaxation, certain types of manual lymphatic drainage activate the lymphatic system. And I think that's also why this is so effective, because it's during the night.
Do folks ever just pop into your office, Laura? I mean, do you encourage folks to come by?
I always encourage that. We're really a referral business, but yeah, that happens every once in a while.
Where are you all located? Obviously in Merle's Zone. You said you're the only physical therapist in Merle's Zone?
I think pretty much in the Grand Strand.
Oh, come on. Who handles lymphedema?
We see physical therapy.
There's a lot of physical therapists, though, right?
Right. The myth that we were kind of trying to address initially with the interview is most people think physical therapists just handle hip fractures and strokes and amputations.
Isn't that all they do? Yeah. Right.
But, there are so many. There are pediatric physical therapists and cardiac physical therapists and lymphedema physical therapists. Now, we have as many specialties as medicine, basically. So the fact that there's this niche that has not been addressed, I'm welcoming other colleagues to please come and become interested in it. But I think the young therapists want to do
this same
things.
Number doctors can call, or their support staff, 651-7513, of course, to go online. will they see some of these pictures? Is there a place where they need to come in the office to see these before and after?
Now that you've had the interview with you, I think I'll put more of these types of pictures on the website. And
great idea.
They'll see themselves, or they'll see their patients in the website.
Their pictures are, I mean, their faces are redacted. No one can see their faces.
Right.
Obviously,
no
privacy issues to be concerned about. But if a viewer was coming to visit, they'd be traveling down 17 Business, right through the heart of Murrells Inlet.
Right, past the restaurants, and if they get back on the bypass, way down in the south end, they've gone too far. We're almost the last building there. On the right, we're called the Creek Professional Suites.
Great.
We're at 5276 Highway 17 Business South.
Okay, 5276 Highway 17 Business South. That's wonderful, right there in Murrells Inlet, the seafood capital of South Carolina.
Oh, honey, she crab soup.
Yeah, there's some. I'm trying to think where the best she crab soup is.
I don't know. I'll put Cedar Hill Landing up on you.
Yes, absolutely. Cedar Hill Landing, virtually across the street from your. One other thing I think a lot of folks wonder, in some of these pictures here, we can't really tell the sex, but is this a girl thing?
No, it's a guy thing too. It's an everybody thing. Because a guy can get damaged lymphatics. Let's say that gentleman had prostate cancer and they were irradiating the inguinal area.
Right.
The leg might blow up, and quite frequently it does, and we end up managing the leg. With women, quite often it's kind of pelvic stuff. If they have the cancers of the uterus and the ovary. And
I got to ask this last question. We got 30 seconds. What got you so interested in this, Laura?
I've been a therapist 32, 33 years or so, and it just fascinated me. I did orthopedics and gerontology and cardiac rehab, a lot of different aspects of physical therapy, and I think it's probably the reason why I'm still a physical therapist today, because there's so much variety in the field that it's kind of like once you've learned something, and if you're a quick study like I am, you don't get too bored or burned out. You go to the next specialty, and it becomes an incredible fascination. And it also, when I studied the area, it became an area that I knew was not addressed.
Right.
And needed to be addressed.
Absolutely.
The Grand Strand needs to know that we're here.
That's great.
And
Laura,
I appreciate
thanks so much for being with us this morning. Very definitely.
Thank you so much.
Stay tuned to more Carolina People with Laura Flint coming up next. We ran out of time, just ran out of time. Ran out of time, couldn't focus on the big Christmas show at Theater of the Republic there in Conway. I'm holding up this picture here, and you're wondering, how can you be talking about a Christmas show? But this is serious stuff. Laura Flint, or Flint as she's known by friends and family, and obviously lots of patients. This is a big deal. Take a look at that. Before and after. If you've seen friends or loved ones, family members, or even you yourself, whether it's this pronounced or even something just a little more than that, the lymphedema could be the cause there. Could be the real problem you need to be thinking about. 651-7513, 651-7513, Specialty Physical Therapy. Specialty Physical Therapy right there in Murrells Inlet. Easy to find right before 17 Business and Bypass wrap up. Look at that. This is serious stuff. Take the time to learn more about lymphedema. Go online to specialtyphysicaltherapy.com, specialtyphysicaltherapy.com.